All right, it is our final segment this morning with Dr. Gill Wright, Chief Medical Director of Metro Health. It's good to have him on. He's a very easygoing, nice guy. It's the first time I've had a chance to meet him, and we've had some good directors of health here in Metro. Okay, so some people looking at, there's other vaccines out there, and the one that comes to mind is a shingles vaccine.
Right.
Okay, I guess if you've had chicken pox, you stand a chance of someday, not guaranteed, maybe getting shingles.
Right.
You don't want shingles. Have you ever had shingles?
No.
Have you talked to someone who had shingles?
My grandfather had shingles.
And do you describe it as a pleasant experience?
No. It you get lesions that are kind of like chicken pox, only all together, and they're usually in one nerve distribution, so on your arm or back or wherever, and they hurt.
They burn, hurt. It's not like a chicken pox thing where you itch. It hurts.
It burns, it hurts, and you can have long-term, even when the lesions go away, you can have long-term pain from it.
Okay. All right.
So it is not something you want.
So who should get a shingles vaccine?
So anyone that's immune compromised, and especially those over 55, should at least talk with their doctor should they get it, because we don't want to give them, we want to make sure that it's the right person to give and the right time to give it. But yeah, they should get it. It's preventative. There's a newer vaccine that works very effective in preventing, and it does have some side effects. Expect to have a really sore arm, more so than you would have with COVID, and most people some aches, and
for a day or so.
For a day, maybe two.
Is it a series of 2 shots?
It is.
Okay, so the first one's the one that might knock you on your butt. My wife had it, and the first one, she did feel a little achy. Second one, she didn't have as much problem with. And it's like 2 months later?
Yeah, and everybody's different. So, I mean, I had it. Both times I was really sore, achy for about a day.
Okay.
But some ibuprofen.
And so, yeah, you make that. So I don't fit any of the categories you really said. Now, I've had chicken pox, which means that virus is in me, which means there's a chance it could surface as shingles. I've not had a history of anyone in my family having it. But and I'm a healthy person in general. So should I get it?
Well, 55 and older, I think should. Definitely if you're over 65, then people should.
You just say, even though you probably were betting, you'd say, Nick, the odds are you're probably not even going to get it if you don't. I mean, shingles. But there's a small chance, and if you can prevent it, why the heck not? Because it's so dang awful.
It is. It is awful, and why not prevent it if you can?
Okay, that's my way. Did you have I don't know, in your head what the cost is on those?
I don't know.
I don't know.
Again,
my insurance will probably cover it.
Again, insurances cover it.
Because it's preventative. It saves them money in the long run. They don't want to treat me for shingles as opposed to just pay for the shot, right?
Right.
Okay. I don't know. Those are the only ones that come to mind. Are there vaccines for any other illnesses out there that some people consider that I'm not remembering here?
Well, definitely pneumonia shots for those over 65. And there's actually 2 different vaccines that cover different strains. So you really should get both because they do cover different strains.
Pneumonia.
Yeah.
Okay, and that's, okay, for someone like me, you would want to wait until you're 65 to get a pneumonia shot?
65. There are people that have got diabetes or some underlying medical condition their provider may recommend they get it earlier than that, but 65 and older, definitely.
Okay, and what is that? I should remember this. What is the vaccine they recommend, say, when students go off to college or whatever?
Meningitis.
That's it. Okay, gosh, you don't want that.
No.
And so meningitis vaccines sometimes, not everyone. My son didn't get one, I don't think, when he went off to UT, but...
Right. We've noticed that there is an increased chance for those that are living in communal living, so dorms, recruits for the military living in barracks, those types of individuals should get it because it does spread very rapidly, and it's not always fatal, but it has a lot of side effects and long-term issues. So.
Would you say, as a man of medicine, as we wrap things up, vaccines as a scientific development rank in the top 3 greatest achievements in human history?
I think that they're right up there.
Seriously, now people, think about what I just said. In human history, in terms of achievements, and there's so many wonderful things, but in terms of lives saved, vaccines, which still boggles my mind that there's people that don't like vaccines, but in human history, I rank it top 3.
it's right up there in some of the top things I can
like
think of.
antibiotics and others in the medical world, but vaccines have saved millions and millions of lives, dating back, centuries. You know how it is. Keep that in mind, right?
Yeah.
Do that, and they're available to you, and they're affordable, and that's the way you want to do things. Dr. Wright, a pleasure. Do you think we'll talk again?
Sure.
So you were okay. This was a pleasant experience for you.
Absolutely.
A lot better than getting shingles. Thank you for coming on, sir. We'll talk to you again soon. Stay tuned. We have a special piece to throw your way in just a moment that you want to stick around for. Back right after this.